And we're recording, and I hand it off to Dave and Ruth to introduce themselves and get started.
Great. Thanks, Ryan. Hi, everyone. Thanks for joining us today. My name is David Ng. I work at Mass Housing. We are the state's housing finance agency. And we, along with DHCD, we fund and provide oversight of the tenancy preservation program. So we are here today to talk with you about both the existing program, which has been around for about 20 or so years, as well as the expanded eviction diversion initiative services. And so I'm actually going to turn it over right now to Ruth Harrell-Garvey, who works for Bay Cove, to talk about the existing program.
Thank you, Dave. Good afternoon, everybody. Once again, my name is Ruth Harrell-Garvey. I work for Bay Cove Human Services, which is a nonprofit social service agency located in downtown Boston. And I've been affiliated with the existing tenancy preservation program since 2002. So as Dave said, the program's been around for a while. What I'm going to talk about today is the existing program, either to inform any of you that are not aware or to just go through it and refresh for any of you who are aware. In general, Tenancy Preservation Program is a homelessness prevention program, but the difference is that it's under the umbrella of reasonable accommodation. So we do partner throughout the state with other providers who also provide homeless prevention, but our specialty is for individuals and families who are facing housing instability due to nexus between some type of disability or maybe a untreated impairment, and with a plan to address that and kind of cooperation with the housing provider to work to stabilize the housing and prevent homelessness. TPP is available throughout the state. There are different providers, and we'll give you more information on that later. And we are affiliated with the Housing Court Department, which also covers the entire state. We function as a neutral party to both the landlord and the tenant. So if we had a client, the client would be the lease, and work with, as I said, individuals and families with disabilities, behavioral health disorders, complex health needs, mental health, substance abuse, physical limitations, etc., facing eviction because of the behavior related to the disability or the health condition. Next slide. Thank you. So what the program specifically does is we assess the reasons for the eviction, the underlying disability or health issues, whenever possible, identify or locate or research or advocate for services that are needed while working with the tenants to try to engage them. We do run into a fair amount of people who have, for various reasons, disengaged from any type of treatment or from a level of treatment that's appropriate, and then develop a service plan to maintain the tenancy, which is to bring the tenants with support and hopefully cooperation from the housing provider and the court into becoming lease compliant. And then we are a short-term program, so whenever possible, we do try to hand off to more long-term community providers whenever possible, or come up with some kind of a third-party notification plan. But we do monitor on a case-by-case basis until the household is somewhat more stabilized. We do communicate with all parties, so there is a need for cooperation on all parts. We have to get permission to be able to speak with folks and vice versa, involved in the case as needed. And, you know, some days or years have been harder than other because of the challenge of affordable housing and adequate housing stock. But whenever possible, if the tenancy cannot be preserved, if it's not an appropriate tenancy for many, many reasons, such as maybe a higher level of care might be required than independent housing with support, then we will facilitate referrals to other agencies and try to transition services Always, always, always with the aim of preventing homelessness. Next slide, please. We take referrals from anyone. We're all across the state very proud of the amount of referrals that we get from housing providers. We, of course, do prioritize referrals from the housing court itself, including the housing specialist and the judges. We get a lot of referrals from legal services and tenants, and can just call us as well, which they do. And we also take referrals from various types of service providers. We have had in the last, I want to say, 3+ years, which has been really exciting, where we are able to also serve folks outside of court in what is called upstream. So it's prior to any type of a formal notice to quit or termination of tenancy. And the goal, of course, is to work with folks outside of the actual eviction or other kind of court involvement process. And that's a very exciting way to, work on prevention and stabilization. Our cases that we get that are already in housing court are coming to housing court in the immediate future. Historically, of course, there was a moratorium, but things are back rolling in the housing court. And we consult with the housing specialist department, which is a part of the housing court. They provide mediation, they provide, depending on the situation, things such as views of the unit if it's necessary, depending on what the alleged violations are. And of course, we also consult with judges whenever we feel like we can do that in a way where no more harm is being caused. We do ask for there to be a delay in the proceedings to allow us time to finish an assessment, develop recommendations, see if we can engage the tenants if they're eligible for services, and work with our other partners for other referrals or to connect them with a better fit if they're not eligible for our program. Next slide, please. So we will be taking any questions if there's anything that I can clarify on behalf of, I'm representing the statewide programs, but just to give you a little bit of a taste, this is a case study. It kind of has multiple issues going on at once. Julia is a 65-year-old woman, so she's considered demographically an elder, living in subsidized housing, and she's received a notice to quit for non-payment, disturbances, and failed inspections, which speak to conditions in the home. Once in court, she disclosed a history of mental illness with previous treatment in the past. When the judge was informed of this, the case was continued for a month, pending assessment and service planning. And in cases like this, we do put things usually in conjunction with the court and the housing provider, just some kind of expectations. Sometimes you might have a short-term agreement for a continuance that just has some stipulations. So just to make sure people are safe during the assessment period and the service planning period. In this particular case, TPP discovered lapsed health insurance, which is not uncommon. Sometimes people think they might have Mass Health, but they've been disenrolled or need to sign up for a particular program, and that there was no access to psychiatric medication. In this particular case, the person was DMH eligible, so TPP assisted both with the health insurance enrollment and then re-engaging with DMH, connecting Julia to treatment providers, and in this particular situation, also a particular program to make sure that the rent was paid moving forward, so that was being done by a third party, and monitored her compliance with the referrals, the follow-up, the engagement, until she was approved for DMH services in the community. So I think at this point, I think Dave has been checking some of the chats, and I think we'll open for a couple of questions on the existing program. There will be information later in terms of how to contact TPP providers throughout the state, and every city and town in Massachusetts is covered by a TPP program as well as by a housing court department. But I would always, encourage anybody to just reach out to me directly so I can connect you to the right person. And I know Dave does that daily.
one of the questions is, how does one refer a tenant to TPP?
Referrals can be done by phone or email. We do have landlines during this current stage of the pandemic. They might not be checked that day depending on the schedule, but we do have some hybrid type of both in-office and out-of-office schedules, and then email as well. And that information
Great.
will be provided. All the providers are doing the same thing.
Thanks, Ruth. And another question is, does the disability have to be documented in order to qualify?
Not necessarily. I think that's something that we can work with either existing folks involved with the tenant, or if there aren't any, we can do our best to look at what the history is and kind of maybe if someone needs a current assessment. So we can tease that out a little bit, but somebody doesn't have to be labeled necessarily. Keep in mind, if there might be many folks in the community, there are many folks in the community that are not DMH consumers because they don't fit that criteria, but are suffering from a significant psychiatric or other type of impairment that's affecting their housing. So I think that TPP was initially designed to catch folks that might fall through that crack where they're functioning but not able to be 100% lease compliant and need more support, but they're functioning well enough that they would not fit current DMH criteria.
That just came up in the chat. So if someone has a disability and has not yet received a notice to quit, but has had numerous, sounds like negative interactions with the landlord, where the tenant feels like her rights have been violated, and the landlord has threatened eviction, should this person be referred to TPP, or do you think it would be more appropriate to refer the person to legal aid?
I mean, some of that I think should be determined by the tenant in terms of what they're seeking, but I would encourage a referral to TPP if the tenant is not willing or able or interested or doesn't feel they have a need to look at some of the other things and are simply looking for legal consultation and possibly services. We can facilitate those referrals whether or not we open the case.
Great, thank you. So I think that's it for the questions in the chat. We are going to take additional questions at the end of the presentation. So why don't I move on and talk about the Eviction Diversion Initiative new services. So primarily there are two things that make the TPP EDI different than the traditional tenancy preservation program. The first, like all of the EDI programs and services, in order for a household to be eligible, they have to be experiencing a housing crisis that's been caused and made worse by the pandemic. And so, so that's consistent across all of the EDI services. The second is that for this EDI initiative, we are eliminating the requirement that a person needs to have a disability or any kind of a health disorder in order to qualify. We are still looking to serve the folks who are the sort of highest need. We really, because the programs are expanding with only a couple of staff people each for the most part, we are trying to target these really sort of high touch services to the folks who most need that type of assistance. I think we've heard through some of the other trainings that the expansions in legal services and at the HCECs will also provide some case management assistance, sort of a lighter touch case management. And so I think a way to sort of differentiate between those case management services and the TPP EDI is that we are really trying to work with the folks who are who just have higher needs. If it comes to it, when the programs are serving the EDI target population, if we do need to prioritize across the different referrals that the programs will receive, we will be prioritizing the folks who are EA eligible, so emergency assistance eligible. So that's families with kids under 21 or pregnant mom who are at 115% of the federal poverty level. Any household that has experienced domestic violence, as well as low-income seniors, which is at 80% of AMI. Next slide, please. So what will TPP EDI do? Essentially all of the things that Ruth has talked about, but because we are looking at a population of folks who most likely are experiencing an economic crisis, we are imagining that most of this assistance will be around helping folks through the RAFT and IRMA application process. So all of the things that are necessary for that household to be able to submit a complete application and have the application be approved. As I said earlier, because we are targeting these services to the folks who are in the greatest need, we are also looking to provide those households with any kinds of social service referrals. And so that's really another way to think about who should be referred to TPP EDI versus the Legal Services Case Management or the HCEC, is that if your interaction with the household makes you think that they really need some services, that really refer those folks to TPP, and they will figure out what those services might be and how to connect them in the community. Because we are thinking that this is mostly going to be around assisting folks with the RAFT and IRMA application process, we think that these cases will be closing a little bit more quickly than a typical TPP case. I think, over the years, I would say that TPP cases generally stay open 6 to 9 months, depending on the nature of the issues that are involved. We're thinking that these cases will be closed a little bit more quickly, and that when the payments are made to the landlord, that assuming that there are other sort of service needs, that the TPP providers will be able to close those cases. Next slide, please. So when to refer. As I've said, I think you should refer anytime you think that a tenant is going to have some difficulty making it through the RAFT application process. So if in your conversations with a tenant, they're confused, they express to you that they don't think that they're going to be able to manage all of the steps that are involved in completing an application, then you should absolutely refer those folks to TPP. And also, if there are any concerns expressed by the tenant around needing other services, whether for themselves or for other family members, that would also be a completely appropriate referral for the TPP EDI. One thing that we haven't mentioned yet, which I realized that we probably should have mentioned earlier, TPP traditionally only works with tenants. It is not a program that works with homeowners. Before the EDI expansion, we will be working with homeowners who otherwise would qualify for IRMA. So in the same way that if you are thinking, when you're thinking about a tenant who might have some difficulties completing the RAFT process, similarly, if you are talking with a homeowner and you think that they're going to have difficulties completing the IRMA application, please feel free to refer those households as well. And similarly, if the homeowner expresses needs around services, then that would be an appropriate referral as well. And all of the TPP EDI services are starting next week. Next slide, please. So this is just a quick little chart to differentiate between the two programs. So disability is the obvious one, where folks need to have some type of disability or health condition to qualify for the existing service, and not so for EDI. The COVID piece is only specific to EDI. Lease violation is an eligibility requirement for both programs, except for homeowners, obviously. Sustainability. And so for the traditional TPP program, sustainability does need to be a component of whether or not the programs are able to open a case. So for example, if a household, they may have a disability, but if they are unable to afford a market rent, and so whether or not the program can provide connections to existing community services, if in the end the rent is not affordable, then that is not a case that the program is going to be able to assist with. For EDI, sustainability, we think about it around the RAFT and IRMA financial assistance. And so if someone qualifies for those programs and is able to maintain their housing with that assistance, then that satisfies the sustainability requirement. In both programs, the household needs to agree to participate and work with the program staff. The court and landlord participation. So we have yes there. The one, I guess, instance where you don't necessarily need the court or landlord's active participation is for upstream cases. So if a tenant has been referred to the program before any type of legal action or any action has been taken by the landlord, the program can potentially work with that household to assist them with whatever resources that they may need. And in terms of priorities for the existing TPP program, any case that is referred by the court is a priority, as well as cases where the household has a subsidized tenancy, because those, once someone loses a subsidized tenancy, I think we all know that it's very difficult to be able to get another subsidized tenancy. And as I mentioned earlier, for EDI, we are looking at EAL cases where there's some domestic violence or low-income seniors. Next slide, please. As Ruth mentioned, we do have regional programs, and these the programs are oriented towards the housing court and each of the housing court divisions. And so Ruth works for Bay Cove Human Services, which operates in the Eastern Division of the Housing Court. You'll see the listing of all of the other regional providers. Just a note, so Father Bill's and Mainspring serves both the Metro South and Southeast divisions of the Housing Court. And the Western Division of the Housing Court is served by two different providers, Berkshire County Regional Housing Authority in Berkshire County and the Mental Health Association in Hampden, Hampshire, and Franklin counties. Next slide, please. And this is our contact information. The third link, the statewide map with the regional contacts. The first page of that is literally a map that is color-coded to show which communities are served by which program. If you blow it up really big on your computer screen, you could actually read the names of the towns on the map. You could also always reach out to me and I can connect you to the right program. The second page of the map also has the contact information for each of the program directors. So I think at this point, we'll go and take a look at the questions in the chat. Oop. Thanks, Ryan. So this first question, a client having housing issues, married but currently separated, ex-partner used to pay the bills, is not a member of the household. Would this client qualify for TPP? She is not the head of household in her current unit. Ruth, do you want to help me think about that?
Sure. I mean, definitely refer it for an assessment. The things that would need to be teased out is the type of housing, subsidized versus private. Also to find out whether or not it's COVID related in any way. If the particular person did not fall under either the existing TPP program or the expanded EDI, which doesn't sound like that. for any reason, then we would gladly still provide consultation and look for the most appropriate either recommended solution or service provider in terms of another housing or homeless prevention provider. We also, most of the programs also do a lot, whether it's via consultation or through direct service provision, negotiation with both private and subsidized landlords, and some of us are trained mediators. We could also make referrals to the existing and expanded mediation services out there.
Great. Thanks, Ruth. I see in the chat that Roberta just wanted to make a note that COVID legal assistance expansion is only available to households that have been served a notice to quit. But the legal aid, the expansion of legal aid services can do upstream work. Am I reading that correctly? Yes, and you can find that information at evictionlegalhelp.org. Sorry, the chat's going quickly. So Annette echoes Roberta's point. So Ruth, I want to ask you to take this one. So if a client has a child with court... Oh.
Dave, hi, it's Annette.
Hi, Annette.
You can't see me, but I'm here. I just wanted the point that I wanted to make, echoing Roberta's, is on the website, the providers can find a referral form. And so you have to dig a little, but there is where it says legal help. Service providers can provide, there is a referral form that you can use. So I just wanted to highlight that. Sorry, thank you.
Thanks, Annette. So here's a question. So if a client has a child with court involvement and is having housing problems as a result, where should the client be referred? So I would say you should refer that household to TPP EDI, depending on the nature of the child's issues, that could potentially be a TPP case as well. Ruth, would you agree with that?
Yeah, they would definitely refer to TPP for further assessment. There's a lot of things that would need to be clarified just in terms of best determining different recommended interventions or next steps. Court involvement would have to be clarified. Housing problems would have to be clarified in terms of whether it has to do with the child's behavior, type of housing in terms of what the expectations are, and so on. So I think a TPP assessment would be helpful one way or the other. But you know, there would be a lot of different pieces to tease out. But yeah, that sounds like a TPP referral. You know, in order for the existing TPP programs, there are certain things that we don't have a magic wand for, that we do try to search for them whenever possible. For example, we cannot make an unsustainable tenancy sustainable. We can't make something unaffordable affordable. And at the same time, depending on the severity of people's behaviors or criminal activities, we can't for certain say what that outcome would be, but we can always assess and we can always work with household members and anybody involved minimally on harm reduction. You want me to take the next one, Dave?
Sure, thank you.
Sure. So this is from Kelly Turley. Could you please clarify lease violations and eligibility? I don't think for the existing TPP program, you really need to worry about that because the existing TPP program has a court program where there would need to be what's termed a notice to quit for eligibility. But all the TPP programs statewide have the upstream. And so a lease violation is really anything just for the purpose of just encouraging you to make referrals, just anything that could be putting the housing at risk. So some examples, and Dave, you can pitch in if you think I missed some, but these are just examples, they're not inclusive. Maybe poor housekeeping, particularly if it's a unit that has to be inspected periodically, or if it's poor housekeeping and it's, you know, affecting someone's quality of life. Poor housekeeping can also, for tenants, affect other people in their building. If something going on in the unit is impeding the quiet enjoyment of neighbors, perhaps, or causing security staff or management to send letters being concerned about behaviors. Certainly any kind of non-payment, we don't have to wait because of our opportunity to work with folks prior to court. We don't have to wait for a large arrearage. What we see a lot in the Metro Boston area is problems with recertification of income and rent, particularly these days with people's income being so deeply impacted, inability to access unemployment. So just recertifying and making sure people are paying accurate rent shares. What do you think? Any big ones you think I might have missed, Dave?
Well, I mean, there's just so many reasons why people can be referred to the program. And I would say just broadly that if you think that someone could benefit from sort of a social service intervention, you should refer. And, you know, the program staff can assess the situation. They can talk with the tenant and figure out what the best next step is. In some instances, that will be the program opening up sort of a formal case and working with them around the lease violation and whatever needs that they may have. In other instances, it may be that the program determines that the household isn't eligible for services, but they will direct the household to other services. Hopefully there are other services in the community that can assist with whatever that tenant's needs are. So I think we've heard this across many trainings, is that sort of when in doubt, refer and we'll figure it out. And I think also one of the points of the regional meetings that I think many people have been a part of is that gives us an opportunity, gives the programs, the local programs, an opportunity to chat about that. And so over time, we may see some trends that maybe there are some referrals that would make more sense for it to go to one agency and another referral that goes to another. And so I think until we start getting into some of these referrals, it's a little bit hard to know exactly where something should go. So refer, and then we'll figure it out.
David, hi, it's Roberta. If I can just echo what you're saying, it's fine to refer to multiple places. And I think at this point, particularly where we're seeing kind of low referrals in some areas, it would be good to refer to more than one place, and we'll figure it out. Don't be shy about referring for help.
Thanks, Roberta.
You want me to take the next one?
Yeah, sorry, I lost my place where we were in the
Sure.
chat.
The other one, the next one's from Wendy. Is there any other option for clients that might not have a disability or have not been affected by COVID? So just to echo on what David and Roberta have said, refer. If it's an economic issue, you know, I'm not sure, you know, what is available in that particular region or area for an unaffordable rent. But it's certainly worth it to refer. The other thing I want to comment on that is sometimes there's no identified disability or impairment, but we look at the whole picture, or as much as the tenants will allow us to look at. Is there a history of trauma? Is there a history of homelessness? Is there a history of domestic violence? And sometimes there does come together an underlying kind of functionality or you know, things that are more subtle that could be impeding the current housing. So it's worth referring. I think the next one, Dave, I'll read it, but I think you kind of already answered it unless you want to elaborate a little further. It's from Betsy. DV client with mortgage in husband's name. She remains in home with children, but now needs financial assistance. Mortgage not in her name, so not sure if she's eligible for financial assistance. In court with divorce, would this be a case? I mean, I think some of that's going to get teased out after the rollout on the 15th. Would you agree?
Yeah, so I think this is an instance of what Roberta's comment about, you know, maybe broadly refer. This feels like we need multiple eyes on this situation, that we need the folks who administer IRMA to let us know whether or not this household would be eligible for IRMA. It seems like probably not, since the mortgage is not in her name. But then what other financial assistance might she be eligible for? It might be a situation where we need to involve legal services. And so I think wherever this tenant is, refer to many of the EDI stakeholders so that everyone can sort of look at it from their piece. And then it may be a situation where multiple providers need to get together to figure out what the best way to assist this person is.
I think the next question speaks to the same theme. Betty
Right.
asks, can a family be referred to multi-agency for different sources? For example, a RAA can help with financial, but then TPP can assist someone in the household with mental health. Yes. I mean, that's the aim and the goal, is collaboration. If a particular provider might provide similar services, we always have conversations around what piece are you doing? What would you like us to pick up, and try to collaborate in that way. Sometimes we don't know about other providers, but the goal is to be transparent so we can be as helpful as possible. And then I think the last part is actually echoed in the question from Holyoke FRC. Once we refer a family, and remember, we can take individual referrals as well, will the referral source be updated if a case is opened with the client? So this is the one thing that is important to keep in mind, is that all the TPP providers are affiliated with some type of a nonprofit or social service agency. So that is driven by the people served in terms of who they allow us to speak with. But that is always the goal, and it's always presented as this would be, beneficial for all, most importantly, the person, family, or individual served. So to the extent that we have permission, we will do that, but there are times for various reasons, and some of them can be untreated mental health reasons, or just requesting privacy, despite our suggestion that it's good to let folks know where things are at. Those would be the times we could not let you know. And typically what we would say is we're just not able to provide you that information. That's usually a clue that we're not being allowed to.
Ideally, though, the tenant signs a release of information that allows the program to share information.
They do, but they do specify who we can and who we can't. So there are those, but it's not the norm.
Thank
Any
you both.
other?
Well, I was just going to say, in this pause, I am just putting it in the chat again in case anybody missed it earlier, but I'm just sending the link to where this recording and a copy of the presentation will be posted for anybody in this training that hasn't joined us before. All the other trainings that we have done so far, this is the last scheduled one. That could always change in the future, but all of the other trainings are posted on this website, and this recording of this will be posted before either by the end of the day or sometime early tomorrow. And then I will also send out an email to everyone just alerting you that it's up. But anybody else have any other questions? I know in the presentation at the end, Dave and Ruth did give their email addresses. If anybody has specific questions after we're done here. Oh, Dave, Ruth, if there's no other questions, do either of you have any parting thoughts?
Refer. That's, when in doubt, refer.
Yeah, and I certainly want to thank, on behalf of all the TPP providers, Mass Housing and Department of Housing and Community Development, for this opportunity to be part of helping folks on an ongoing basis, and certainly the large majority of people impacted by this current pandemic.
Thank you. And actually, there's just one question that came in. To the extent a landlord makes a referral, how does that process work?
Generally speaking, if the landlord makes a referral, the next step is always to speak directly and reach out directly and collaborate directly with the tenant, and then loop the landlord or housing provider into that process.
Great.
keep in mind with a lot of the, if it's a financial issue with a lot of the rental assistance that's been discussed, the landlord needs to be brought back into that dialogue at some point and into the documentation process.
All right, looks like we're just getting a bunch of thank yous. We appreciate it. In the absence of any other questions, thank you all for joining us. Thank you for all the hard work and long days that each and every one of you are putting in to get us through this, and we definitely appreciate it. And all right, thank you all. Have a good day. Stay safe, stay well. Thanks.